This next one is a case report on COVID infection with polymyositis, where one's muscles can become inflamed, weak, and painful. This is a case where the patient developed myositis following acute COVID infection. The patient had both radiologic and biopsy-proven neuromuscular manifestations of COVID associated with polymyositis, where shortly after initial infection, proximal muscle weakness began and progressively got worse over the next weeks and months, resulting in immobility. This was a 19-year-old male who presented with mild flu-like symptoms and generalized body weakness secondary to COVID infection. After 4 weeks, he noticed muscle weakness in all 4 limbs, legs, and arms. All baseline blood values were normal, except for there were raised serum levels for acetylcholine receptor antibody, creatine phosphokinase, CPK, and atolase. And importantly, on electromyography, this is EMG, they saw that nerve conduction studies revealed myopathic changes in these proximal muscles. And this was confirmed after a biopsy was taken from the quadriceps, which also showed a focal lymphocytic infiltration. After this myositis diagnosis, he was put on oral medications. He was put on folic acid, methotrexate, and oral calcium, in addition to a tablet of prednisone. And after 6 months of this treatment, he was mobile, still possessing reduced muscle strength, but gaining mobility and strength overall. So ultimately, we know that COVID can reach the central nervous system through the blood, which can directly impact neurons as well as indirectly impact the surrounding neurons. Importantly, in this patient, the muscular symptoms developed after the initial phase of COVID. So this was after a negative COVID test on a PCR. And that there is a danger of having this proximal lower limb weakness because you can have falls, where this muscle weakness and inflammation can not only impact the proximal limbs, so the arms and the legs, but also the eyes and the facial muscles as well.